we are going to get into the nitty-gritty and maybe messy details about Pitocin today. Hopefully answer all of your questions about Pitocin. I'm going to start with the definition just to make sure we are on the same page. Pitocin is artificial oxytocin. So oxytocin is the hormone in our body that is the one that regulates labor. So oxytocin makes our uterus contract. And contracting of our uterus is the work of labor. It is how our baby gets out. It's how our cervix dilates. We need it. If we have our labor started artificially by a doctor or midwife, they might use Pitocin. So Pitocin being an artificial version of the hormone that would start labor. So Pitocin and oxytocin actually do the same thing. So they both tell our uterus to contract. And the big question is Pitocin harder? And does Pitocin hurt more? Or are Pitocin contractions more painful? And that is a tricky question that I want to really look at. The big difference here that we see in artificially induced labor and labor that begins on its own really has to do with the pace. It's the pace that I think when we hear people say that Pitocin contractions are harder or that an induction is harder, it's really about the pace. And so I have been thinking, and when I teach, I try to think of different ways to relate it to real life, and I have an analogy that I want to walk you through that has to do with hiking. And I found this awesome mountain in South Africa called Table Mountain that is a perfect example that I want to use for this hiking analogy. Table Mountain has several hiking trails that lead up to the top. So I believe there's 4 main paths that you can go up Table Mountain. And when you get to the top, you're there. You get to the same place. And so it's kind of like inducing labor and letting labor start on its own. You get to the same place in that you have a baby at the end, right? But with Table Mountain, you can take the longer, more scenic, and less challenging route up to the top trail. So it takes you on a path that is doable for most people, and it will take a while, and you actually cover more steps on that route. And then there is another route that goes up Table Mountain that is pretty much a rock face that has a lot of bouldering, that has where you are actually using your hands to climb, and it is for experienced hikers. Now you cover less distance, but it requires a lot of strenuous activity. So, and then there's 2 that are in between these. But I like to think of a labor that begins on its own really takes that nice, slower pace. So when we let our labor begin on its own and let oxytocin do its work, our labor generally starts off where contractions are light, they don't last that long, and they're pretty far apart. And we have a bit of time where we're kind of learning how that feels, and we are getting used to dealing with it. We're starting to use our coping mechanisms. We're feeling, our body is feeling what that's like. And then as time passes, our contractions get longer, they get stronger, and they get closer together. So we are being eased into the most difficult part of labor. So we start at that early labor where it's doable for most people, you can handle it, and then as we go along and get closer to the pushing phase of labor, then it's more intense. So it's almost like that hike where you start off just kind of in the shade and you're walking along and it's easy. Then it starts getting more difficult. It is higher elevation change. And then maybe at the very, very end, you're having to go over boulders or do some more strenuous hiking. but you have eased yourself into it. Pitocin induced labor is more like a hike where you're waiting around until it's time to go, and then once you start, you are full on giving your most strenuous effort continuously until you're at the top of the mountain, until you have the baby or ready to push. So it's kind of like a full sprint. So it can feel harder because we didn't ease into it. And it can feel harder because the contraction pattern is actually closer together at an earlier time. So if we had a labor that begins on its own, that 2 to 3 minute contraction pattern is usually a few hours in, if not many hours in. And then it's at the end of our labor. And with a Pitocin induced labor, we actually have that pattern, that every 3 minute pattern that starts at the beginning. So we have a pattern that is very close together, very challenging for most people, but it is for generally a longer amount of time, more at the beginning. The contractions themselves might not be more intense with Pitocin. They might or might not, depending, but the pattern definitely is more intense. So there's really no denying the fact that an induced labor pattern, you are going to experience contractions closer together for a longer period of time than a labor that begins on its own. So going into it, that is something that I want everybody to realize, that Pitocin itself is not evil. We are better off in this world of having Pitocin. It is there for safety. There are many medical reasons that a labor needs to be induced, and so thankfully we have Pitocin. Pitocin also is given after you have a baby to help the uterus clamp down. In a lot of healthcare facilities, they do that routinely, not all, and that can be life-saving to prevent a postpartum hemorrhage. So Pitocin itself is not evil, but that Pitocin contraction pattern can certainly be challenging. So it's something to know, especially if you are someone who is maybe interested in a low intervention birth, maybe interested or unable to get an epidural, wanting to avoid an epidural. You might consider, what is that going to look like if I have to be induced? And is that something that is the plan that I want if I have a choice whether or not to be induced? Now, research does say that people that are induced are more likely to choose pain medication, and they're also more likely to choose pain medication earlier than non-induced. So it kind of goes hand in hand. If you have intensity that is starting earlier in your labor, then you more likely to choose some kind of pain management earlier in your labor, right? So the contractions themselves are not necessarily stronger, but yes, Pitocin creates a pattern that can be more challenging.